Good evening, alumni. Good evening, colleagues. Thank you for being here, and also thank you to our guest speakers. I'm now going to introduce our first guest speaker. That is Dr. Kate Jordan, who graduated twice from CPUT in 2006 as well as in 2009. In 2006, she graduated with a National Diploma in Emergency Medical Care, and in 2009, she graduated with a degree in Emergency Medical Care. In 2014, she was featured in our CPUT publication, Grand Meg, and a quote from that was, when she first heard about EMC or emergency medical care, she knew very little except that the job involved driving fast cars and flashing lights and wailing sirens. When we interviewed her in 2014, she was already a fifth-year medical student at UCT, and she graduated in 2015 with a Bachelor of Medicine and Bachelor of Surgery. Currently, Dr. Jordan is a general practitioner in a private practice. Welcome, Dr. Jordan.
Thanks very much, Prof. Appreciate the introduction, and thank you all for having me here tonight. Let me get on with the presentation without any further delay. Just going to try and share my screen here with everyone. Can you all see that slideshow?
Yes, we can see it.
Yes. Okay, so I'm going to be talking about, thank you, I'm going to be talking about debunking the myths around vaccines and just addressing some of the more common misconceptions with regards to vaccines. It's quite a big topic, so I really just chose the bigger ones and have really just brushed the surface of all of them. So an old wise GP once told me there are 4 things that you need in life to survive: water, food, shelter, and vaccines. But then along came the anti-vaccine movement, which we all know about. It's quite an old movement, but has recently gained more momentum. It started in the 1700s with the smallpox vaccine. Some didn't want to give their children the vaccine and later lived to regret it after watching their children suffer and die. It all stems from fears around vaccine safety, religious objections, and science skepticism. It was really shaped by 2 main events. One was the film called DPT, The Vaccine Roulette, which claimed a neurodevelopmental link due to encephalitis. And then a study that we're all that's quite well known to all of us, by Andrew Wakefield, about MMR and how it might cause autism. We also know that that was later retracted. So the first the first myth I'd like to bust here is vaccines cause autism. They don't. The study was done in 1998, and Andrew Wakefield suggested this. It was later found that the study was very flawed. It was retracted, but unfortunately the damage was already done. There have since been many studies have disproved the theory and many papers disproving Andrew Wakefield's theories. However, it also showed that the power of social media and public figures also play quite a large role in the damage that has already been done with this myth. The next one is vaccines contain harmful substances. They do not. Each vaccine does contain ingredients that keep them safe, they keep them effective, and they keep them long-lasting. They each contain an antigen, which is an inactive form of the virus or the bacteria. They contain an adjuvant, which boosts the immune response to the vaccine itself. It contains preservatives, which prevent growth of harmful bacteria and fungus within the manufactured vaccine. And then it contains stabilizers, which protect the vaccine during storage and transport. Thimerosal was one of the main concerns quite some time ago, and the concern was about mercury. Thimerosal has been removed from vaccines largely, but in older studies from older vaccines containing thimerosal, it was found that there was a safe body burden for methyl mercury, even in low birth weight infants receiving multiple vaccines. So that myth was busted. Natural immunity is better than vaccine immunity. Well, it really is a gamble. You may or may not develop an adequate immune response to a disease with natural exposure, or you may develop severe symptoms and complications, including death from natural disease. Vaccines are by far safer. Some diseases have no cure at all, as we found with COVID, only prevention with vaccines. If you allow yourself to naturally acquire a disease, you may end up permanently disabled, as we've seen with polio, or of course dead, which is the ultimate problem. The risk of vaccines outweigh the benefits, which is not true. Vaccines are safe. There's very low risk of serious complications or allergic reactions to vaccines. All vaccines go through vigorous and rigorous safety testing and clinical trials before being approved for public use. Vaccines, at the end of the day, save lives. They give people the opportunity to live healthy lives, and unvaccinated children and adults face illness, disability, and death. Thus, to say that the benefit of vaccines actually far outweigh the risks. Too many vaccines overwhelm the child's immune system. This is also a myth that's been busted. They do not. Children are exposed to thousands of pathogens on a daily basis. The current vaccine schedule prevents diseases from around 14 of the most harmful pathogens that they will face. The vaccine schedule that they're on now only expose the child to about 300 antigens in this time. So it's far fewer than it's encountered on a daily basis. So I've just wanted to go into some of the myths that have come up with regards to the COVID-19 vaccine. I'm sure everyone's very interested in that topic. So the first one, if you've had COVID-19, you don't need the vaccine. So we found that reinfection with COVID-19 is possible, and shown thus far that the body is unable to maintain an immunity to it from natural disease. Early evidence suggests that there is only short-lived immunity after natural infection. And at this stage, it's not seen that vaccine offers better long-term protection. How long? Sorry, it is seen that the vaccine offers long-term protection, but we're not sure how long yet. Sorry, something gone wrong here. Okay, the COVID-19 vaccine was rushed and cannot be trusted. This is not true. The specific method of mRNA vaccine creation has been in development for many years, and one of our speakers is going to cover the COVID-19 vaccine in more detail, so I'm not going to go into much detail here. But China sharing the genetic information early on in the pandemic allowed for prompt adaptation to the already known method of development. There was a lot of money and research pumped into the development of the vaccine, and we saw governments pre-ordering and paying for vaccines before it was even developed. So there was a lot of money involved. Social media was able to source and engage with willing volunteers to help with research. There were no steps or phases that were skipped. Some of them were overlapped to save time, which is understandable. COVID-19 is also so contagious and widespread that it didn't take long for us to gauge the effectiveness of the vaccine. So it was quick, but it wasn't rushed. After the vaccine, I can stop wearing my mask and I can stop taking precautions. This is not true. You still need to practice safe COVID protocol. The vaccine is not 100% effective and can't prevent COVID from entering your body. It does prevent moderate to severe disease, but you can still get mild disease. It's thus far found to be 100% effective against death from COVID-19, which is really actually what we want. you can still infect others if you don't wear a mask and you don't practice precautions. And lastly, the COVID-19 vaccine. Yes?
2 minutes.
Oh, thank you. The COVID-19 vaccine changes your DNA. The COVID-19 vaccine does not enter the nucleus of the cell where the DNA is stored. It uses a messenger RNA in the cell, not in the DNA, to code for the spike protein. The code then sends a signal to the body, but as I say, this is going to be covered later, to recognize the specific spike protein when it enters the cell and to kill it. So no, it does not change your DNA. I know this was quite a quick presentation, but I just wanted to cover the most important sort of myths and legends that come up with regards to vaccines and some with regards to COVID-19 vaccine specifically. I hope that it shed some light. Does anybody have any questions?
Thank you, Doctor. Are there any questions, colleagues? You can put them on the chat, but I will allow a few hands that have some burning questions. Are there no questions? If there are no questions, maybe I can.
Questions?
Maybe I can ask one question, but now I need to dismiss this timer. Sorry about that.
Okay.
I'm sorry. Maybe I also have some COVID here. I just wanted to find out about the different types of viruses. I mean, of vaccines that are there. I know there's the mRNA one, and then there's also the J&J.
Are you talking about specifically with regards to the COVID vaccine?
Yes, the COVID vaccines.
I think that, if I'm not mistaken, Andre is going to be covering the COVID vaccine specifically. I think yeah, he'll be going into the types. Can I leave that for you, Andre, when you get to your presentation?
No,
I think that will be proper. Any other questions, colleagues? No questions? Okay. Do you have any idea in South Africa how are the people receiving and how the anti-vaccine movement is going? Is it as strong as it seems to be in America?
That's a very interesting question, Prof. I actually don't have the answer to that question. I know, in private practice, I do see quite a few patients that have decided not to vaccinate themselves or their children. The numbers specifically, I wouldn't be able to tell you that.
Prof. Matcha, this morning, 10 o'clock on ENCA News, there was a few placards in front of some of our clinics where people were against the vaccine. And then they showed where this, Archbishop Emeritus Tutu was vaccinated, and he then actually spoke out against those people that were protesting. And then they showed various centers across South Africa, in particularly deep rural areas where elderly people were all very happy to be vaccinated. So I would think from even today's Cape Times report that those are the minority, and that people are just battling to register because older people don't all have access to internet. And that's why our figures are only at 30% registrations for 60 plus at the moment.
Thank you for that. I'm trying to go between my chart as well as to try and see if there's any hands. Dr. Vemba, I see that your mic is on. Do you want to say something?
I just spoke. Oh, you didn't hear me?
Oh, that was you. Okay.
Yeah, it was me that responded to Dr. prior speaker's question, or just making a comment, because I watched for about an hour this morning on the TV. That's so nice about being retired, on this anti-vaccination protest, and then the deep rural areas where people are very, very happy that they showed people being vaccinated in deep rural Eastern Cape, Limpopo province, but the majority cannot register. They don't have access to internet. And I think even in the Western Cape, our registration figures are only 30% because people don't have access. And the Premier has asked again and requested again this morning that we with access must help those that do not have access, and encourage younger family members to register the 60+ people.
Thank you, Dr. Vember. If there are no further questions, we will then move to our second speaker. May I just find out if Peggy is in the room?
Unfortunately not, Professor, but she emailed me her presentation. And I think it's very important because we have a listed down. I just text her now. I'm sure that she has connectivity problems. For all the audience, to the audience out there, she's based in Durban, and she experienced some connectivity problems early on when we had a dry run at 4 o'clock. Now it seems the connectivity problem is still present there. So I have a presentation. Do you think it will be fine if we show it on the screen and somebody talk through it? Either me or somebody else, Dr. Vember, because it's a PowerPoint presentation. I can also do it, it's fine. What do you propose, Prof. Macha?
Perhaps maybe Dr. Vember or you could do it, but let's just get the name who will do it when we get there.
Okay, but I still want, because she's prepared it, so I still want you to show the audience who prepared it and who was going to deliver it. Unfortunately, she's not present in the meeting. Will that be fine? So I'll share her screen now on her bio on the screen. Is that okay with you?
Yes, thank you.
Dr. Vember, would you like to read Peggy's presentation, or can I do it?
That will be fine. If you would like me to do it, I will do it.
Thank you, Dr. Vember. You will read it. Thank you. I will put it on the screen, but I'll first show Peggy's bio. Hold 1 second. Over to you, Dr. Prof. Macha.
Okay, thank you. Peggy Ncangase Tabata matriculated at Fezeka High School in Gugulethu in 1992. Soon afterwards, she joined CPUT and registered for a national diploma in biomedical technology. She then completed and entered the world of work, but then returned again to CPUT, where she completed a BTech in biomedical technology and a master's in nursing, and also a certificate in project management. Peggy has 2 princesses, Pindile and Yondela, and 2 sisters, and loves reading and helping others. She says her 2 dogs complete her family, and they are all well loved too. Currently, Peggy is based at the Medical Research Council as a chief medical technologist. Thank you. The talk, please.
Val, can you make it a bit bigger, please?
Use the show button at the bottom.
Oh yeah, okay, I'll do that. Yeah.
No, this one here. Val must go to the show. Start showing slides.
Okay, that's fine. Thank you. That's much better.
Okay, but you should have gone to show slides. Slideshow. There it says set up slideshow.
Right on top, Val. There we go.
So then I click where?
Say okay.
Val, just click from beginning and you'll be.
Yeah. There we go. Okay. Okay, thank you. So I do this with great pleasure on behalf of Peggy. And the topic is the importance of vaccines. Change, please, Val. Second slide. So the first slide is about the importance of vaccines. And I think it became very clear for us during the COVID period. And like the previous speaker said, the only saving grace would be for all of us to get the COVID vaccine. And yet, in previous years, as we also heard during the myths presentation now, it was very clear that when the word vaccine was mentioned, many people thought about the pain that was going to be caused by administering the vaccine, instead of focusing on the benefits that vaccines might have offered. So particularly in today's world, we are faced with so many health threats. Many parents get overwhelmed when they are told about the number of vaccines their babies need from the time of birth. And we also just heard that it's really not so many vaccines. The infant stage is the most crucial time of vulnerability to communicable diseases. Hence, it is deemed important to vaccinate them against various illnesses. Next slide, please. So in those days, it was very sad time for societies and communities and individuals who had to witness their loved ones getting infected and eventually die from severe diseases like was mentioned already. Smallpox, poliomyelitis, all of those we managed to eradicate in our country. But at the same time, there were reports of vaccines opposing events, and this was due primarily to the growing number of vaccinations taking place. The communication of side effects was being misinterpreted and causing confusion to the people, just like today, lots of confusion and myths around the COVID vaccinations. Education, therefore, was and still is extremely important about all types of vaccines. So according to these researchers, the burden to infectious diseases within societies have been significantly reduced by vaccines. In the United States, for example, an estimated 103 million cases of childhood diseases were prevented through vaccines since 1924. And during the 20th century, many infectious diseases ranging from influenza to rotavirus became vaccine preventable. And this has made the vaccine become an effective investment in humankind. You can move, Val. So besides directly protecting the vaccinated individuals, most vaccines also provide indirect protection to the unvaccinated individual. When plenty of people in communities and different societies are vaccinated, the number of people,
pathogens,
the number of pathogens that are spreading the infection are reduced. This is how the diseases like polio, mumps, and measles were eradicated by public health officials. So when diseases are unable to spread, they die out at a certain vaccination rate, and eventually they get eliminated. This is referred to as herd immunity, And this is what we currently, the entire world is struggling for, so that we all can get herd immunity. So there might be many alternative ways to reduce risk transmission of diseases. However, vaccines remain the most effective tool to prevent sicknesses and death from pandemics and developing threats. Hence, the public is always encouraged to be vaccinated during seasonal influenza. So education about vaccines seems to be most important for all our populations. And so we need to educate people about the safety and the benefits of vaccines using traditional and social media. Very important, so that we take all cultures into consideration. Fear of side effects should be corrected. All the medication that are ever used have side effects, and they have package inserts that are explaining these side effects. But communities use them anyway, and sometimes they do not even read those package inserts. And I think all of us are aware of the 5 people out of the millions that developed blood clots and all of those on the first round of the vaccine, of the COVID vaccines. So pregnancy, oral contraception, and smoking are associated with blood clots, just naming a few. However, the population is still using them because their opposing incidents are rare cases, and we all are researchers or involved with research, and we know how important it is to do these things, but also how to interpret these results. So acceptance, therefore, of vaccinations can be done by educating individuals about getting infected and affecting others, namely family, friends, and communities around us. Scientists, therefore, should communicate the scientific truth and be able to draw the attention of social sciences and the relevant stakeholders to do the awareness and health education and promotion on the importance of vaccinations. So why is vaccinations therefore so important for children? Firstly, parents want to do everything possible to make sure their children are healthy and protected from preventable diseases. Vaccination, therefore, is the best way to do that straight away after birth. Vaccination protects children from serious illnesses and complications of vaccine-preventable diseases, which can include amputation of an arm or a leg, or hospitalization, pneumonia, hearing loss, convulsions, brain damage, and death. So vaccine-preventable diseases such as measles, whooping cough, and influenza are still a threat, particularly in our low socioeconomic and poorer communities. They continue to infect our children, resulting in hospitalizations and fair amount of deaths every year, particularly in our third world countries. It's therefore quite, can you just move down a bit? Well, thank you. So through vaccinations, it was led to a dramatic decline in number of US cases of several infectious diseases, such as measles, are quite common in other countries, particularly in South Africa and third world countries, like I've just said. And therefore, it's important that all international travelers are vaccinated as well. And I'm sure most of us have traveled and know that we go for vaccinations before we leave our country. So if children are not vaccinated, they could easily get one of these diseases from a traveler or while traveling themselves. Outbreaks of preventable diseases occur when many parents decide not to vaccinate their children. Vaccination is safe and effective, and all vaccines undergo long and careful reviews by scientists, doctors, and the federal government in all countries to make sure that they are safe. And equally, that happened now with COVID as well. Excuse me. Organizations such as the American Academy of Pediatrics, the American Academy of Family Physicians, and the Centers for Disease Control and Prevention all strongly support protecting children with recommended vaccinations. Vaccination protects others you care about, including your own family members, friends, and particularly older people, your grandparents. So if children are not vaccinated, they can spread the disease to others, children who are too young to be vaccinated, or to people with weakened immune systems, such as transplant recipients and people with cancer. This could result in long-term complications and even death for these vulnerable people. So if you follow the news, you will see that currently almost 50% of our new infections are among school children. There's 2 private schools that's been closed in the last week in Pretoria, and 2 public schools in the Limpopo province that were closed because of the amount of COVID infections amongst these school children.
Yeah.
So we all have a public health commitment to our communities to protect each other and each other's children by vaccinating our own family members, or making sure that from small our children are being vaccinated.
Oh.
So I think that what Peggy was trying to say, that the importance of vaccination from childhood already to build up immunity, so that as an adult that you can resist most of the infectious diseases that's around us. Thank you very much.
Thank you, Dr. Vemba. I see that you have been mentioned in this presentation, so we could take a couple of questions that we can all try and address from this topic, if there's any. I see no questions, and I don't see anything from the chat. So with that, we will then move to our last speaker for this evening. Val?
With you now, Prof.
Okay. All right. Thank you. So it gives me pleasure to introduce Andres Tradon, who studied at CPUT and Groote Hospital for clinical technology and qualified in 1990. In 1994, he changed his career and joined the pharmaceutical industry, where he spent about 14 years, and he was involved mostly with marketing, and then moved to drug development planner and eventually became a product manager. His portfolio covered multiple therapeutic fields, namely anesthetics, oncology, antimicrobial, cardiology, and gastroenterology. This period saw him involved with numerous drug launches and international development programs, such as AstraZeneca and Nicomed, a few of the companies he was associated with over his 14-year period in the pharma management. He has a strong desire for clinical work with patients, saw him return to full-time practice in 2008. Apart from optimizing ICU procedures to treat critically ill patients, his professional interest tends towards general diagnostic ultrasound. As of 2017, he is the only non-doctor to be registered as an Emergency Medicine Society of South Africa emergency ultrasound examiner. He has also completed HPCSA accredited programs in general ultrasound and echocardiography at Wits, UCT, Stellenbosch University, and the Foundation for Professional Development. Currently, Andre is the Chief Clinical Technologist at Livingston Hospital in Port Elizabeth. He's actively involved in the training of registrars, busy with critical care in ICU procedures, and has a passion for developing doctors' clinical application skills with ultrasound training. To this end, strong association has been formed with the following professional bodies that are named here: SASA, CCSSA, EMSSA, and where he presented and facilitated diagnostic ultrasound courses nationally. His hobbies include music, martial arts, and motorcycles. And in September 2020, he shared this story with our CPUT alumni office, where he wrote a song. He said he decided to write a song, record all the music in my studio, part-time hobby, and got all my doctor colleagues to do the singing. There are also 2 professors who were overjoyed by being asked to do the last 2 verses. So he says we can just Google this, but considering that we have a bit of time, perhaps maybe we can end the session with that song. Hopefully we can get to that. Over to you, Andre.
That certainly is. That is usually for the publications in magazines and stuff, so I do apologize for the long-winded amount of information there, but thank you for sharing that. Folks, I realize that what we have to do here is to try and keep things as basic as possible, that everyone can, for the average person, understand the condition and what we're dealing with. So, can you all see that slide?